For me, the hair loss process began when I was 22 years old. I was lucky to have thick, beautiful hair back then. I didn't worry about my hair much, like most people who have good hair. In reality, my hair loss wasn't caused by using bad shampoo or using some water that wasn't right for me. It was just a matter of genetics.
So initially, Mr. Amir mentions that his hair loss started at the age of 22 years and it wasn't because of shampoos or water, and he rightly identifies that his hair loss was probably genetic in nature. This is the most common cause of male pattern baldness, which is also known as androgenetic alopecia. People inherit particular gene by the name of AR gene, androgen receptor gene, either from their paternal or their maternal side, and this gene is represented to a large numbers in these hairs which are prone to fall, especially in the front or in the mid scalp and the crown region. So this is the area where this gene is represented, and because of excessive or high 5-DHT level, this becomes the root cause of hair loss.
I thought about my hair loss sometimes, and it scared me to see how quickly I was losing hair. Still, I never thought I'd lose my hair, but my hair loss didn't stop. I didn't even notice that I had lost almost 20% of my hair before I knew it.
So he started losing a lot of hairs very quickly, and this is a typical case of early onset androgenetic alopecia. A person who is started losing his hairs in early 20s, probably it is a more aggressive kind of hair loss issue in these patients as compared to people who are in their late 40s or 50s and they started losing the hairs. When you start losing it at a very early age, it is imperative that you start taking medical treatment as well, because the hair loss is progressing very, very rapidly in your case.
It's a well-known rumor that water in the UAE is not beneficial for hair. While I can't confirm this, my hair loss seemed to accelerate after moving there. Within less than 2 years, I had lost between 44% to 50% of my hair.
Next, Mr. Amir mentions that he got a job in Dubai in UAE, and he says that the water in UAE is considered not to be good for the hair. So friends, this is a very circumstantial kind of evidence. It's not a definitive proof that water is the primary culprit of your hair loss. These factors which are apart from your genetic or your hormonal issues, these are known as epigenetic factors, and this can include your water, this can include your diet, stress and other things which can indirectly cause your hair loss, especially if you're changing your country, going to a new country, and these are the times when you have that natural stress, and this can sort of trigger or stimulate your hair loss, although it's not the primary reason for your hair loss. Then he mentions that he lost around 50% of his hair, 44 to 50%. So when you lose more than 50% of your hairs in a specific region, that is the time when the scalp visibility drastically or dramatically increases. How much is your exact hair loss? This can only be definitely told by doing a trichoscopic evaluation of your donor site and the recipient site, and sequential trichoscopy is very helpful in determining the kind of hair loss you are having. So going to an exact percentage like 44 or 50%, I think it's too specific without any such kind of evidence. But it is safe to assume from the pictures we saw in the videos that definitely his hair loss was progressing at a very rapid speed.
I chose to have my transplant in Pakistan primarily because it was the option I was most familiar with. I knew that Turkey was known for having good hair transplants.
Then Mr. Amir shares his detail about his first hair transplant which he underwent in Pakistan. It is seen that he is wearing a big dressing. Not many clinics actually use this kind of dressing, although it's an individual preference of a doctor of a clinic or a clinic to put such kind of dressing, but it's not really essential. We do not put a dressing like that, a bulky dressing. In fact, when you're taking out the dressing after a couple of days, sometimes it has been seen that the grafts can stick to this dressing and it can come out, but it's an individual preference. Then Mr. Amir mentions about Turkey being a good choice of hair transplant. So friends, this is very important for you to understand that although Turkey is a very known country, but it is the clinic which you have to choose. Which clinic you should be choosing, it depends on the clinic and the doctor. No country as such is having an expertise in hair transplant. There are a lot of good hair transplant surgeons in almost all the countries nowadays, although definitely Turkey is better known for this. We have made a video on how to identify good clinics in Turkey, and you can watch it on the link given above. Then pictures of the transplanted area after his first hair transplant show that the hairline is good in the front, but the frontal tuft or the middle region is very thin, or the roots have been, or the grafts have been placed very sparsely with a very low density. And the other issue is the railroading, which means that the grafts are looking like they're parallel to each other. These parallel insertion of the grafts can sometimes look very unnatural, as we know.
I was happy with the results. But after 2 years, my hair started to thin again for no reason. It was really upsetting for me to see gaps in my hair.
Then we see his results, which look good initially, but after some time, he mentions that after some time, his scalp visibility again starts to be quite on the significant size. His hair loss is increasing, specifically because we do not know whether he has been on the medicines or not.
I thought that after the hair transplant, my hair would grow back the way it was before. I was wrong about what hair transplants were supposed to do. I thought they would totally restore my hair to its original state, which is not quite right.
After showing his results, he says that his scalp has started showing back again and hairs have become thinner. He says a very important line. He says that he expected that his hairs will become same as what they were before when he started losing his hairs. So friend, this is actually not correct to have this kind of unrealistic expectations, because we can take out limited number of hairs from the donor side, and with that limited number of extraction, you cannot have the same density as what you had before your hair loss started. We have made a very detailed video on reasons why you should not undergo a hair transplant, and this is a very useful video for people who have very unrealistic expectation. If you have those kind of expectations with a hair transplant procedure, then probably hair transplant is not the procedure for you, and the link for this video is given in the link above.
For my second hair transplant, I once again picked Pakistan. To be honest, I don't know why I didn't choose Turkey for my second surgery, especially since I could now afford it.
But then he talks about his second hair transplant, which he also got in Pakistan. And the picture which has been shown here shows the hairs to be placed quite densely in that area. So this is really a good quality hair transplant which he probably underwent in his second sitting.
After the transplant, once again, things went well for about 8 months. But then I started losing a lot of hair. I asked my doctor about it. He told me it was because of the medicine he had given me. After my surgery, he gave me a certain drug that I had to take every day. It turned out that this medicine was making hair grow temporarily. As soon as I learned this, I immediately stopped taking the drug. I wanted to see the genuine outcome of my transplant without any medicine. It was sad that after 2 months, I started to see gaps in my hair again.
Then he mentions about the results which he got after the second hair transplant. But there is a very important fact here. He mentions that he started losing hairs because of medicine, and his doctor told that because of the medicines he started. No, this is not correct. Medicines in fact prevent further hair loss and does regrow the hairs to some extent, and these are temporary hairs. But if you do not take these medicines, your hair loss is going to progress. And hair transplant is a procedure which cannot be done many times. Like in his case, he's underwent 3 hair transplants, but it is not something which you can undergo once every year or once in 2 years or so, because the donor site is limited. So these hairs have to be used very judiciously from the donor site, and medicines can in fact prevent further hair loss of the existing or the natural hairs which you have before your hair transplant. So it's very important. Finasteride and minoxidil are US FDA approved. If you have some side effects, there are ways you can minimize the side effects or the possible side effect of these medicines. Specifically about the finasteride, we have made a video on the side effect of finasteride and how you can minimize the side effects of finasteride, and you can watch the link given above.
And it made me think about getting a third hair transplant. Klinikana is a famous hair transplant clinic in Taksim Square, Turkey. Unlike my past experiences, they only prescribed medication for the first week post-surgery. It was new for me, as I was expecting a lot of medicine for the next 8 months. I asked why I wasn't getting any extra medicine. They simply said it wasn't necessary. I decided to trust their expertise and see how things would unfold.
So because he was not on medicine, he stopped his medicine at around 8 months. His 10-month result do show a thinning in the transplanted area. Then he goes to Turkey and plans for his third hair transplant, where the clinic surprisingly tells them that they are not going to give him any medicines. So I think this is not correct. You have to be on medical treatment. Anything like minoxidil, finasteride, or even something, not just a 5 to 7 day medicine, which is probably antibiotics or painkillers just to heal your transplanted hairs, but you have to be on the medicines.
The results I saw were incredibly phenomenal. Unlike my previous experiences where I had covered gaps with my hair, this time my hair looked naturally full. What made Clinicana stand out was their great care after surgery.
Then we can see his results after his third hair transplant. A very important thing to notice here is that the length of the hairs is quite long here. And as we all know from the formula of hair volume depends on the length of the hairs also. So if your hairs are longer, your hairs after the transplant are going to look better. And but he is pretty excited, and we have seen that his hair results are definitely better, probably because of 3 sittings of hair transplant in that same area. We definitely wish that he gets a good hair in a long-term kind of results he gets out of this hair transplant. But probably in our opinion, if he keeps on taking the medicines, his results are going to be longer lasting, and he can prevent further thinning and further expansion of his hair loss. So friend, this is about hair loss case, which is a very interesting case. Please subscribe to our channel if you want to keep on watching such interesting videos. Thanks a lot.